How would you describe the National Action Plan to a clinician, and how would you describe it to a patient?
So, to a clinician, I would say, first of all, there are a lot of organizations out there in the U.S. working on patient safety, and we know that sometimes that can be challenging to people on the front lines because there's different recommendations coming in from different areas, and it all kind of bombards that front line. So our goal with this plan was to say, let's try to coordinate and decide what we all think is important and get behind strategies and tactics that we all think are important that we can then push down into hospitals, health systems, clinics, and the frontline provider and have that coordinated approach. The other thing I would say is, the goal of this plan is to really drive safety for patients and the workforce, including those frontline providers, and to focus on those foundational areas that we think are relevant no matter what you're trying to improve. So you may be an outpatient primary care doctor thinking about missing test results, and you may be an inpatient ICU doctor thinking about central line infections. But what we're working on in this plan, we think will help advance the work in any of those areas because it is so foundational. So that's how I would describe it to the frontline folks. And to patients, I would say, patients are at the center of this. Our goal is to get to a world where we have zero harm to patients and the workforce. And when we talk about harm, we're talking not just about physical harm, but emotional harm. And so we have included patient advocates throughout the whole process. We have one of those foundational areas really focused on patient engagement because we think it's so critical to have patient involvement in thinking about safety solutions. And, we want to work together with providers, with patients to try to get to that zero harm goal.
Yeah, that's great. So probably no surprise, we've been working on this for quite some time. So almost exactly the way that Dr. Gandhi describes it. But a couple of things I would add. No, I think that's a good thing. That's actually what we're trying to achieve is again, this common shared view, if you will, that reflects, the perspectives of many different diverse organizations. But ultimately, their care happens at points of care, and that's, I think, what we're trying to support. So I think for frontline clinicians, I think that's the simplest part of the message is that, hopefully as a result of this work, they will see and benefit from the better alignment that we're going to have across all these organizations who really are trying to achieve the same thing. It's again, as Tejal said really well, it's prevention of harm, this vision of zero harm, which hopefully we'll get closer and closer to. And then I think for patients, one of the things that the question reminds me of is that, since I've been working in this field, several years now, a lot of things are different in a very good way from a patient's perspective. Some of them are confusing and maybe even a little disconcerting at first, but we really are engaging patients more. One specific example is just, asking a patient their name to confirm, the correct identity. We know that, patient misidentification is still, unfortunately, a big challenge, a big problem. And so making sure we've got the right patient, for example, before a procedure, it's very commonplace. I have family members who've had, operative procedures, and they'll get asked intentionally half a dozen or more times, who they are and what their procedure is, which side is it supposed to be on, if it's, for example, an orthopedic surgery procedure. And again, patients at first may not understand that, but I think it's commonplace now for them not only to be asked that, but for them to get an explanation of why they're being asked, so often. And I think that represents patients being on board and part of the process. And I guess the final thing I would say, a little bit of a technical concept, but I think increasingly more and more a part of healthcare in general, and that's this idea of co-creation, that, patients' care is not something that's just done to them, that, it's all been planned and designed without their involvement. I think that's what's come through and part of the plan, and we've seen in other parts of healthcare generally, that really involving the patients at all stages of development, including planning and designing care. And so I think that that's frankly fairly new and a new concept when I think about older relatives that I have, and that's a much different concept than kind of how care was when they first started accessing the system. So I think a lot of hopefully good things will come out of the plan, and those are just a few of them.